To begin with, both essential macronutrients and a healthy baby. The mother can suffer from various issues, and not only the mother, but even the baby can have anemia, fetal hypothyroidism, impairment in the brain and vision. Everything can be linked back to the food we eat. There is a proportion of babies, IUGR, with intrauterine. Of that has to do with during pregnancy, and improve our consumption of during pregnancy. Macronutrients, we know that a pregnant woman needs about additional calories per day during the second trimester. When it comes to carbohydrates, proteins, and about 45 to 60% of the food, your calories come from carbohydrates, 3% come from fats and healthy, and let us stress on the importance during pregnancy. In a non-pregnant state, a healthy adult requires about 1 gram per day of protein. This increases to 1.5 to 2 grams per kg per day. So this is not always met by our food that we take. Protein supplements in the form of either whey protein or the more digestible plant proteins really improves the health can you hear me? So I hope I'm audible and you can hear me. It would be really the audience gets the right advice, as so many people have logged in with us today. So let's continue. When about plant-based proteins or whey protein that we need to see, that will help improve the pregnant woman. It helps in the development and growth of the. Now, another important nutrient is fiber. Increased fiber intake is very important during pregnancy. Helps in reducing a common symptom that comes to us. Also, the risk of diabetes. Additional fiber in your diet helps. Now coming to the micronutrients, and of course the top 10 that we are going to. So when you get pregnant, the thing the gynecologist asks you, folic acid is extremely important, as well as during the entire duration of pregnancy. Folic acid helps in brain development of the baby, and it prevents certain neural tube defects like etc., which can really be detrimental to the health of the baby. So all the prenatal vitamins need to be taken essentially before you get you're pregnant. And Folic acid in a dose of 400 to 500 micrograms is recommended to be taken every day. Now, what else? Of course, we know that the second most important one is iron. How can I stress about the importance of iron during pregnancy? 50% of the pregnant patients that come to us are anemic, or they have their hemoglobin is less than 10 grams, which is not good, right? Because anemia during pregnancy, including low birth weight, premature delivery, recurrent urinary tract infections. It is also linked with excessive fatigue and a risk of heart failure during pregnancy. So, iron supplements need to be started. In addition to whatever you consume in your diet, iron needs to be taken as a supplement in a dose of 100 milligrams of elemental. So I think that the internet connection seems to be a problem, but this is honestly the best during the dry run, so that so I'll just I suppose I'll have to continue. Don't have better internet connection than this. The person at the back end can just give me the cue to continue, because I'm able to hear me or not. Right, so going back to iron, so 100 milligrams per day of elemental iron is really important for you. The third and most important is calcium along with vitamin D. Calcium is important for the baby's bone and teeth development, for the pregnant patient's well-being, health, and a dose of 1000 milligrams per day is what is recommended. And this cannot be met by our diet, because you would have to consume a lot of dairy to make up for this much amount of calcium that you need. So you need to take supplements of calcium for about 1000 milligrams per day, because it is very, very essential, and so is vitamin D. So usually most of the supplements which have calcium have an addition of vitamin D in the dose of 2000 international units, which is very, very important. It also reduces the risk of preterm delivery and preeclampsia. Preeclampsia means high blood pressure during pregnancy. Omega-3 fatty acids are also known as DHA supplements are essential nutrients from the second trimester, even you're breastfeeding the baby, because DHA is very important for the baby's brain and visual development. And DHA typically is not found so abundantly in our diet unless we are consuming a lot of fish, a lot of flax seeds. We really need to include these supplements in a dose of 200 to 400 milligrams per day during pregnancy, throughout the course of pregnancy, especially starting from the second trimester. Now, what else? B complex group of vitamins, especially B6, which is pyridoxine, and B12, which is cyanocobalamin. These are very essential. These usually come as a part or a combination of the prenatal vitamins with your folic acid. You will be surprised to know that B6 pyridoxine actually helps to reduce the nausea and vomiting sensation that a pregnant woman feels during the first trimester of pregnancy. And it is a commonly prescribed medicine, in fact, for treating nausea related to pregnancy. So having it as a supplement really helps. Cobalamin or B12 is unfortunately deficient in a vegetarian diet. So unless you're eating non-vegetarian diet, you need to have cyanocobalamin being supplemented in pregnancy, because deficiency of B12 causes megaloblastic anemia. So along with iron deficiency anemia, we have another nutritional deficiency anemia which is called as megaloblastic anemia, which also needs to be taken care of and treated. So having this supplement will reduce your chance of having this sort of problem. So we have spoken about the 5 very commonly known, 5 or 6 commonly known or spoken about nutrients that we know of. What about the others? So vitamin A in the form of beta carotene is very essential, but it should be taken in only the recommended dose. A very high dose of vitamin A supplementation can in fact lead to toxicity. Vitamin A important because it improves our immunity, the baby's immunity, it helps in the development of the reproductive system of the baby. So it is, and the IC is extremely important supplement that needs to be taken, which also sometimes is part of your prenatal vitamins. Remember not to take a very high dose of vitamin A during pregnancy. Vitamin C. So we all know vitamin C was the hero during the COVID era. Rightfully so. So many benefits of consuming vitamin C. Vitamin C cannot be produced by our body, so we need to consume it. Of course, we know that vitamin C, but if we are not consuming enough citrus fruits as a supplement, vitamin C improves immunity. It helps even reduce the risk of preeclampsia, which is pregnancy-induced hypertension during pregnancy. And this is why it is essential to supplement pregnant women with this very, very essential micronutrient, which is vitamin C. All these nutrients, if we see, are very easily available. In fact, there are so many supplements that are available right now these days. Of course, we should try and improve our diet as well and include most of these nutrients in our diet, and in addition to that, we should try and take supplements which will benefit not only us but also the health of the developing fetus. Lesser forms of lesser known nutrients that are also essential are basically magnesium and choline. So both magnesium is important for the baby's bone, teeth, your bone and health. Magnesium reduces cramps during pregnancy that a lot of women face, leg cramps typically. So it helps symptoms. Choline, on the other hand, is important for the baby's nerve, the brain, and the all the neurotransmitters. Basically, these in your body to. So these are basically top 10 nutrients that one must take. And I see here that somebody was somebody's asking about the omega supplements. Yes, omega-3 fatty acids are very, very important. Unfortunately, they are not well known among of whatever reason, but it is essential that during pregnancy one must take omega-3 fatty acids in the recommended dose. because they're very important for brain visual development, which is so essential. Right. And so one more thing that I missed out on was iodine. Iodine, of course, is fortified. Most of our salt and because lack of iodine causes fetal goiter, which leads to hypothyroidism. Hypothyroidism is really development. In fact, it causes a low mental impairment. So you can imagine normal thyroid levels during pregnancy is a nutrient which makes sure hormone levels are taken care of. In fact, any deficiency of thyroid hormones in the pregnant woman excuse me, and rule out if the fetus is affected, then that will be detrimental to the growth, for the brain growth. Yes. So I think we can talk a little more about iron, because iron is something that obviously commonly known, but gynecologists and obstetricians that the level of that we see all throughout India, and in fact I would urge everyone to not just give iron, also have a regular check on your hemoglobin levels. Make sure that, yes, I will take up that question. Make sure that basically your iron is apart from whatever you eat by any sort of hemoglobin of more than 10 grams is essential to take care of the blood loss that happens during delivery. About 500 is lost during delivery, so this makes us lose our iron stores, and the hemoglobin may drop, and if you already don't have a good hemoglobin, this might be an issue, right? So somebody wants to know the protein requirement for veg women. This is a very good question, because women who consume non-veg can get their protein through chicken, fish and eggs. But what about women that don't consume non-veg? So let me tell you the important vegetarian sources of protein. Greek yogurt or plain yogurt is good. Paneer or tofu or any soy protein. Remember nuts like almonds, walnuts, pistachio, or cashew nuts. These all have a very amount of proteins in them. Also, having dairy, then you can have milk as an additional source, because it does contain a lot of protein. Cheese, which obviously you would love to have, and of course, how can you forget lentils and pulses, rajma, white chana? All these are extremely important, and these should be dals diet every single day. Now, if you are consuming diet, if you take about 70 or 60 grams of protein, you still have a deficit of 30 grams. So this can be made up by the protein powder that we generally ask patients. So remember, whatever protein powder you're taking, a plant powder can be very easily digestible. So this will add to your protein requirement, which the food cannot take care of, will be taken care of by the protein powder that you take. So home-based food and no supplements. I wouldn't, I'm also a very big proponent of and trying to make sure that all the food that we consume takes care of the nutritional requirements. But let me tell you that pregnancy is something different. When you're pregnant, you need that extra supplementation, and that cannot be, made up by this, by the food we consume. Women in the village get free iron, folic acid, calcium, and protein supplements during pregnancy. All women over India get these supplements because we know that this is so essential during pregnancy. So maybe you can tell parents at home that special situation. It doesn't mean that these nutrients or these supplements do no harm. They only do good. You can explain to her that the risk in the supplements is far more than what it would be if you are taking these additional supplements, which is prematurity. It is so difficult to deal with a baby who is not in the ideal birth weight as it should have been, and this is avoided just by including these supplements in your diet, which is I cannot stress the importance of all these supplements in your diet. I hope your doctor can explain it. This is what is my honest opinion and suggestion, that maybe you can speak to your mother and try to tell her that this is really recommended worldwide. It's not just somebody who's just trying to give you extra supplements. It's not like that. And I would love to have more and more questions before we stop. Yeah, no problem, Meera. I hope that helped your doubt. I hope it helped clear your doubt about taking supplements. Yeah, in fact, I was taking a plant-based protein during my pregnancy, and it really helped improve. I was pregnant with twins. My protein requirement was even higher. Yes. So it's a little difficult to digest it in the beginning, but once you get used to taking these, you really see the benefit that they can do to you during pregnancy, and you will see the baby. Yes, I think the person, Hera, can definitely help you out with that. If you could say it to your mother and sister, that would be so helpful. So that I think it is important to sensitize everyone in the family about the requirements and needs that a pregnant woman have, especially nutritionally, and because sometimes there is so much talk about what should be taken and what shouldn't be taken. Sometimes is more like garam khana nahi khana chahiye, papaya nahi khana chahiye, chicken nahi khana chahiye. So that's actually, you can eat whatever you like. Any home-based cooked food is excellent for you. Of course, what you need to avoid is something like raw fish or raw or even a raw salad from the roadside, because that can make it is so nutritious. It has vitamin A, it has all the vitamins that you need. You could definitely consume that during pregnancy. Yeah, so I think somebody from Hera can obviously help you out on that. I would like to know if there are any more questions. Also, I would like to add that if you're on a diet pre-pregnancy, and you should probably, pregnancy is not a good time to continue something like an intermittent fasting or a keto, and so that obviously cannot be done during pregnancy. I hope everyone understands that very special time, and you need those additional calories that become healthy, and also for the fetal development, and to prevent pregnancy like diabetes, preeclampsia, low birth weight. And these, then it's a cascading effect, because if you have any of these, the delivery becomes little more dangerous, and so postpartum recovery takes longer if the pregnancy is not smooth. As to how much of importance food and nutrition has during pregnancy to prevent so many complications that we generally see. Of course, there are some that cannot be avoided, but there are a lot that can possibly be avoided during pregnancy by just eating healthy food. I would also say that if you're consuming a lot of refined flour or sugar, this is something that you need to avoid during pregnancy, because it increases the risk of diabetes. Not only that, it can cause refined flour, maida, Maggi, all of these things can cause a lot of constipation, and it really does nothing to help the pregnancy per se. So if you have a craving to eat something, you may either look for a healthier alternative, or you may have it like once in 15 days, which is fine. Of course, it's very difficult to just control yourself and your urge to eat, because there is a desire to eat during pregnancy. But definitely avoid refined food, refined flour, food from outside, packaged food. Be healthy if they have a lot of salt content, a lot of sugar. So these are things that you need to avoid, but otherwise all the healthy supplements are excellent. Food cooked at home is excellent during pregnancy, so try and make it wholesome, your food wholesome. Fruits are so good in your diet during pregnancy. So these, of course, will take care of a lot of issues, and I hope that everyone who has logged in here has benefited. Is pregnant, is trying to conceive pregnancy, has benefited, and also will go back and try to implement whatever suggestions have been given. I'm glad that this was an interactive session, that I could sort of solve the queries of a few people that had really important doubts. So is I think we're done. Is that correct? I can end the live session today. You will include all these 10 important nutrients in your supplements. Remember, folic acid, iron, calcium, vitamin D, vitamin A, B complex group of vitamins, iodine, vitamin A, vitamin C, choline, magnesium, and omega-3 fatty acids. And of course, increase your protein intake during pregnancy. So thank you very much. I'm very happy that the session went off well, and I hope you benefited from it. Stay healthy and have a good and easy pregnancy.